Hi, it's Dr. Christy Reisinger. I'm here at Costco again, and I want to talk to you guys about sleep aids. Man, insomnia is such an issue here in the United States. People really struggle with it. I first need to say, if you guys are really struggling with insomnia, try some non-medication things first, like lowering the temperature of your room, shutting down blue light exposure, decreasing your caffeine. But if those still don't work, there really are three main over-the-counter medications that are promoted and talked about for sleep. The first is melatonin, the second is diphenhydramine or Benadryl, and the next is Doxylamine, which is also known as Unisom. Let's look at all three of them and I'll give you all my thoughts. Okay, first, let's start with melatonin. Melatonin, I would say, probably is the most natural sleep aid. It's been shown to work better in older people, and the doses range from 1 milligram or even less than 1 milligram up to 10, 20, 30 milligrams. I would say, if you're gonna try melatonin, don't feel like more is better. Because I feel like once those receptors are filled in the brain, you don't need to add more. So I would say if melatonin 1, 2, 3, or maybe even 5 milligrams isn't working, it's probably not gonna work. And studies have shown that melatonin works better in older adults. So I'm not sure for my younger patients that it's gonna work that much anyway. Melatonin should be taken a couple of hours before bedtime, and it helps you fall asleep, but it doesn't really help you stay asleep. So that's melatonin. But if you wanna try it, go for it. I feel like the side effect profile on melatonin's great. I mean, I feel like there are very minimal side effects. But once again, let me stress that if 5 milligrams not working, 20 milligrams probably not gonna work either. Okay, next up is Doxylamine. Doxylamine is also known as Unisom, and it is an antihistamine like Benadryl or diphenhydramine. This medication needs to be taken a little bit before bedtime, maybe 30 minutes to an hour ahead of time. And it's just your basic antihistamine like Benadryl. It's gonna cause drowsiness and hopefully help you get to sleep. But, and I'll tell you some of the side effects or potential side effects with this medication and with diphenhydramine or Benadryl. They're very similar because they're in the same class of medication. So let's look at diphenhydramine as well. So they don't sell plain diphenhydramine, but they often put diphenhydramine or Benadryl in something like Tylenol or Advil. So basically, this Tylenol and Advil is basically Advil with Benadryl and Tylenol with Benadryl. Diphenhydramine is just Benadryl, and it's similar to Doxylamine in that it's an antihistamine and causes sleepiness. But I would say if you don't need Advil or Tylenol, don't take that. Just take Benadryl if you need something to help you get to sleep. And both of these medications, like I said, diphenhydramine and Doxylamine, are in the antihistamine class, which means they have anticholinergic properties. That's a really big word, but for older patients, older than 65, anticholinergics like Benadryl and Doxylamine can have some side effects. Like if you have prostate issues, and men, if you're already struggling urinating, especially at night, Benadryl, diphenhydramine, and Doxylamine are gonna make that worse. If you're already struggling with dry mouth or with drowsiness in the morning, diphenhydramine and Doxylamine are gonna make that worse. And these anticholinergic medications have been shown to have a lot of other side effects like memory loss and increased risk for dementia and things like that. So at the end of the day, if you don't have to take diphenhydramine or Doxylamine, and especially if you don't need Tylenol or Advil with it, just skip it. Maybe start with melatonin, and then if you want to advance to something like Benadryl, diphenhydramine, or Doxylamine, you can, but realize, especially in older patients, there are side effects to those medications. Thanks for joining me.